About 10 years ago, I started coming up doing remote clinics in the Kimberley and the Pilbara. And I got distressed because I was seeing lots of Aboriginal children very far down the track when lung disease had really taken a hold and the damage was too extensive to be able to fix. And we had to do something. We had to change the way we were doing things because it wasn't that these families didn't care, it was that they didn't have the knowledge. So chronic wet cough is simply a cough that has phlegm in the airways for more than 4 weeks. The phlegm in the airways gets bacteria in it, and that bacteria actually literally starts to eat the airways. If you find the wet cough early and if you treat it, it can actually prevent lung damage from happening. So it's a very curable problem if we find it early. Geographically, the Kimberley is very isolated and very, very remote, and so you just can't roll up and do your thing. Community need to invite you to come in, and unless you do it as a partnership with community, then you may as well pack your bags up and go home.
So Telethon Kids came to Brahms and as part of a research project on wet cough. So that's how I found out about it, because my child was identified through his multiple presentations with a wet cough to the clinic. I actually was able to get him put on antibiotics and be able to feel comfortable telling my story without being walked out going confused and thinking, was there any more I could have asked, or did I actually understand what he was saying? So the physician actually spoke to me in normal medical terms rather than high jargon stuff, and actually listened to what I was actually saying.
I thought it was just a normal cold until the doctor came to the ward and said that it was bronchiolitis. And after the 3rd, 4th episode, I think I started wanting to know more and more about what's really happening, because you don't ask, you don't know. But not everybody in the community knows about body organs and what really happens and how does all function. Not everyone has good English, and when it comes to doctors and nurses talking, they don't understand. You know, they get frightened to talk to gurrias, you know, white people. I think blackfellas to blackfellas, they feel more comfortable.
Working with the team from Telethon, it was really good. I really wanted to get on board and to, hear what you guys are doing. At the clinic, we get to see all sorts of specialists, all sorts of people, and they just come and go, but we still live here. And all communities are different. They've got their own rules, their own way of speaking as well. And to bring in a team like from Telethon, you gotta have someone there, an actual local, to come in and to show you around.
Working up here, very definitely, I feel like I have been given more from local community members than what I've been able to give back. So I feel a massive responsibility to keep working so that I can keep helping out. And why I say that is because community have taught me to listen. Community have taught me how to do things community way. And it's very different from the way that I was trained as a physio. And it's really exciting to learn how to make the medicine work in community.
I think working alongside Telethon Kids Institute is a very vital thing for our community, because Aboriginal people have been researched on for so many years, and I think it's important that now there need to be more Aboriginal researchers doing the research on our people, on our community.